May not know it, but the person you see at the doctor's office may be a nurse practitioner and not a physician.
Both jobs can appear similar to patients, but News Center's Fauna Haile-Selassie tells us sometimes a nurse practitioner can be actually a very strikingly different job. Tell us about that.
That's right, yeah. Tom and Rachel, if you can imagine, a nurse practitioner's level is in between a nurse and a practitioner, and in fact, many times patients won't even need to see a physician. But while doctor's visits can sometimes be in and out as fast as possible, the nurse practitioner we spoke to says their job is to take time with patients and make them feel more comfortable.
And do you know who you're seeing today?
Kerry Stoick.
Molly and Kyle Larson are expecting their first child in 36 more days to be exact. Their primary OBGYN so far has been Kerry Stoick, a nurse practitioner for the OBGYN at Olmsted Medical Center.
With Kerry Stoick, I had noticed that she's just so friendly. So she made coming to my appointments fun. So
when we do this each OB visit for a healthy check on the baby, we do spend more face-to-face time and personal time with the patient so that they're not just a number that comes in for 10 minutes and in and out. People really feel like they get to know their nurse practitioner.
The Larsons will begin to see an obstetrician soon since they are nearing the delivery date. But they say if it wasn't for Stoick, they would not have known that Molly had thyroid cancer.
people who specialize in ear, nose, and throat, they had felt around there, specifically knowing where it was. And they couldn't really feel it. And they knew that it was there. So I was really, really lucky that she was the one that felt it.
Stoick says a nurse practitioner must obtain their RN license and normally work as a nurse for a few years. Then they go back to school and get clinical training to get their nurse practitioner's license. She says to see a nurse practitioner instead of a doctor can save you about 2/3 of the visit's costs. Stoick says in the coming years, practitioners will play a big role in health care.
As the population ages, and as there's so much with medical care and health care that's changing, people are going to see nurse practitioners more than they're seeing them now even.
Stoick says there are 4 practitioners in the OBGYN section of the Olmsted Medical Center and roughly 1,700 total at the Mayo Clinic. Now, November 9th through the 15th is National Nurse Practitioners Week, and of course, there'll be several events to show the appreciation of these practitioners.
You got to honor them.
They certainly feel an important need that we have.
So true.
Thank you, Fauna.